Hello, Dr. Parineeta. I hope you're doing well and keeping safe. Thank you so much for joining us today.
Hi, everybody. We all are fine. Thank you for asking. And I hope you all are safe in your houses and looking after taking all precautions.
Absolutely. Thank you so much. Today, I wanted to invite you to discuss a bit about the initiative that you have started and the seva that you conduct on a daily basis.
It's my pleasure. And thank you for inviting me. And I hope you get something out of the conversation we are having and there's some takeaway home message from this conversation.
Absolutely. So, Dr. Parineeta, tell us a bit more about yourself first before we dig into the amazing initiative that you have started.
Firstly, I'm an ophthalmologist. I am basically what you call as an eye specialist in a layman language. I'm a surgeon and I have 2, 3 small clinics, and 2 of them are charitable and one is a private clinic. What we do basically is we look after the health, and there was an initiative by the government of India. By 2021, we're supposed to have a blindness, preventable causes of blindness were supposed to be eradicated.
Wow.
In that, we used to look after the cataract surgeries because that is a preventable cause of blindness.
Mm-hmm.
So we have started this seva is because there are people in India and they would be worldwide people. And so we are basically in India so we can look after the health of the patients out here.
That is fantastic, Dr. Parineeta. Can you tell us a bit more about Seva and what it means to you?
Seva, I believe, is giving back to the society. We are working. Being an eye specialist is my profession. And with my profession, yes, I do earn a living, but the love and affection and the trust you people put in my hands, I have to return that. And that is through Seva. Seva is where you do selflessly and you don't expect anything, not even a simple thank you from a person, because it's you doing it for yourself and it has to bring contentment to you. So, Seva for me is giving back to the society the love, the affection, whatever they have given to you. So, this
That's splendid, Dr. Parineeta. And is this for free?
Yes, Seva always is free and selfless. So, what we do is people who cannot afford the treatment, they should not be deprived because they cannot afford it. So, this is my specialty where I don't need to depend upon anybody. So, the surgeries which I do for the people who are in the low socioeconomic group or for whatever reasons cannot afford the treatment, that is why we give it for free. Totally free.
Absolutely amazing. And now, can you tell us a bit more about Mera Vaid Gur Govida, please?
We had to do it under a society, whatever we wanted to. India basically has a lot of diabetic people. So diabetes affects every part of your body from head to toe. Initially, it starts in the eyes, where it leads to 4 different things. Firstly is dryness of the eyes, where your eyes feel itchy. Second, it leads to premature aging of your lens, leads to cataract. Third is it leads to glaucoma, that is your increase of eye pressure. And fourthly, it affects the retina part of it, where there can be bleeding. And all these 3 things can lead to blindness, and which is, if taken care of, is preventable. So what we needed to do to have a comprehensive type of treatment modality. So people who are affected with diabetes, they cannot afford because they are taking medicines, they have to get their lab tests done. It affects your eyes, it affects your nerves, your kidneys. So little bit we can do for them is we can look after their vision so that they can go and their daily work. So, and all the 3 things like the cataract, glaucoma, and the retina part of it are preventable if treated properly. So, what we do here is in the society is we look after the wholesome approach towards a better eyesight, better vision for the people of all age groups, including children, because some children do also have diabetes, and we want them to have a healthy and a nice life. And there's nothing without vision. So that is why we started this society. So all of them, like-minded people, can join in.
Wow, that is fantastic. And why Mera Vaid Guru Govinda? How did you come up with this name?
The thing is, if you have the literal meaning of it, healer is the god. Mera Vaid is in Hindi, it means a doctor. So who person who's made us, he's only going to heal us. He knows the anatomy of my body, my mind, everything he knows. So that is why Mera Vaid, you give yourself to the God.
Wow, awesome, Dr. Parineeta. Can you also share a bit about the Gurnoor Golak and how we as individuals can contribute?
Gurnoor Golak is another branch of the Mera Vaid Gur Govida Society. In this, what we do is we go to schools, all the schools, the middle school as well as the primary schools. Here, the children, they do not know. See, till you do not know what is normal eyesight.
Right.
You do not know how much I can see. You do not know how much a normal person can see. So we need to get ourselves tested at an early stage, which parents don't do that. So we go to all the schools, we do a screening, and if the patient needs it, if the child we see is not normal, we call him to our center. And this is all is for free. We check the child if he has any problems, like for the refraction, for the vision part of it, for squint, anything he has. Then we treat the patient. And if the patient is from low socioeconomic group or cannot afford basic spectacles, which can make him see the world in a better light, we give him free spectacles. And as far as the society is concerned, what you can do for us is, first of all, you pray for us that we follow this path and do the seva first. That is your contribution. If we are there in your prayers. Second call is, what we want from you is your old spectacles which are lying at home, which are not used, and you don't have the time to bin it, because that spectacle frame can help somebody. Thirdly is that spectacle frame helps us for a better, greener environment, because if it goes to trash, and it can be, if it's in a good shape, it can be used. So we take the spectacles, all the donated spectacles, we clean them up nicely and properly. Then we check the patient, and if the patient wants it, we give him the spectacles for his correction. We put new glasses for him and we give those spectacles. So the frames have a longer life. It is even environmentally, it is also friendly. Thirdly is you have a chance of doing seva. You develop that feeling of giving. So this is what we do in Gurnoor Golak.
Wow, absolutely stunning. That is absolutely awesome, Dr. Parineeta. And definitely we will keep you in our prayers. And these glasses are coming back to you. Can you also tell us a little bit about how else can we contribute for the camps that you organize and the surgeries?
What you can help me is, firstly, you can spread the word. You can spread the idea about Gurnoor Golak. You can spread the idea about diabetes. You can ask for awareness. You can spread the awareness that you need to get your eyes checked up at the earliest in case you have diabetes. Thirdly, what you can do is you can contribute whatever little you have, and that will help you to have a feeling of that you have to give something back to the society. And any contribution, neither nothing is small or big, and it will help us in a long way, because we need all your blessings in any way. If anybody wants to come and join the camps, we are most welcome. We'll put it up for you. When are we having those camps? You can physically come here, you can talk to the patients, you can listen to their stories, get their blessings. You can also see how we operate, how are the camps managed. That will make you a good manager also. So it's an open invitation that anytime you people are in India, you are in Punjab, put up the days we have the camps. You can see take away home message from us where you can spread the awareness. If you want any lecture, how the people are affected with diabetes, we can tell you that also. And whatever monetary funds you can contribute, it's most welcome.
Wow, that is absolutely stunning, Dr. Parineeta. Thank you so much for your time today. And definitely, I'm sure more awareness about diabetes has spread across the world. Thank you very much once again, and I hope to join your camps very soon.
Thank you so much. And it's a pleasure talking to you, children. And I wish you stay safe, stay blessed, and know the purpose why are you sent out here, which is very important.
Thank you so much. Have a great evening. Bye bye.
Bye. Thank you.